Hi, my name is Maryam Zamani. I'm an oculoplastic surgeon and aesthetic doctor. I work at the Cadogan Clinic on Sloane Street doing both surgical and non-surgical facial rejuvenation. I have been doing microneedling for a few years now, and I incorporate it with PRP, which is platelet-rich plasma. And I use the microneedling device as a way to induce collagen stimulation. And I was in search of a cordless microneedling device, and I wanted one that had less cross-contamination, and that was the reason why I found this SkinPen. So in addition to being FDA approved, the SkinPen also has a CE mark for Class 1 medical devices, and so therefore I think it's really important, safety first for all of our patients, and having the treatment that has had the most number of studies and approvals. I think it's really important. So I really like the SkinPen, and the reason is I haven't had any, not even one incidence with any, whether I was doing it or somebody else was doing it, with any scratching. So previously, potentially not in my own hands, I did not have that, but I did see in other people, such as the therapist hands who work at the clinic, I would see sometimes some scratches, superficial scratches. I find with the SkinPen, you have more precise microneedling, and that comes from the fact that the needles are so precisely created. And I find that it's with the kit that it comes with, it's just a very nice, efficacious way of inducing collagen stimulation in my patients. Well, I have to say I have had a lot of really great results treating the periorbital area. So this delicate skin is sort of a difficult area to treat in general, and sometimes with different microneedling pens, the actual head, the tip, it can be difficult and cumbersome to use. And I found that I had a lot of ease in treating this area with the SkinPen. So the reason that the FDA approval for the SkinPen is so fantastic is because of its decrease in potential cross-contamination, and this is threefold. So one is that the cartridge is self-sealed, which means that any blood-borne products that have been used on the face and potentially go into the cartridge will remain in the cartridge. Number two is that the body of the SkinPen is also sealed off, which means that anything, if it does touch, will not go inside of the SkinPen. The importance of that is in previous cartridges, in previous pens, there was no seal, and therefore it is possible that you could have cross-contamination, particularly in doing treatments like myself, like platelet-rich plasma, which has blood components as part of the treatment. And finally, the third part of the cross-contamination importance is with the sheath that comes with the SkinPen. And I can't tell you how much easier it is to use something that's been designed for a pen as opposed to making something out of another plastic component used for something else. So I think cross-contamination is the number one reason, and FDA approval, and the two of those combined increase safety and efficacy for the patient.